And let's just take a look in this ear here. Oh boy, that's a lot of wax we got going on. And we can definitely take care of that. Check the other side, A lot of wax in there too. Okay, I'm just gonna do a quick tympanic membrane test, which means I'm just going to take my otoscope and put a little puff of air in your ear just to stimulate that tympanic membrane. So you just hold on. 1, 2, 3. Good. 1, 2, 3. Good. Alright, the other side. Here we go. 1, 2, 3. Good. And 1, 2, 3. Good. Alright. Doesn't look like that's impacted too much. So we're just gonna get right into the ear cleaning here. You can just close those eyes. Relax. Let me know if you feel any pain or discomfort during this, okay? Definitely have quite a bit of wax in here we gotta get rid of. Just gonna use this little fluffy brush to see if we can just agitate some of that wax in the canal here. Shut this up a little bit. So you can pick some more of that out here. A couple little loose bits that have come loose. We're just gonna go in real gentle. Just pick those out. We can agitate it out a little bit more. We definitely have some impaction here. We'll get that all out for you though. Okay. That's just a little more I'm going to be able to get on this outer area here, and then we're going to do a couple drops. Soften up that deeper wax, okay? Okay, so just hold on a second, I'm going to grab my drops. Okay, so we're just going to put a few drops of this softener liquid in. So you just relax, alright? And here we go. Alright, so it's gonna fizz up. Just gonna take a little bit of tissue. Just gonna roll that on. Stick that in your ears. Liquid will come out. Alrighty, let's go into that other ear now. Doing alright? Any pain, discomfort, anything? Good. Okay, here we go. Just relax. If you like, you can just close those eyes. Same thing as the other side here. Just gonna grab one of my tiny little fluffy brushes. We're just gonna try to agitate out some of that wax. There we go. Good job. Good. And back in. There we go. Alrighty. Let's get some drops in that ear here. Alright, and here we go. A few more. Good. Okay. Let's get a little bit of tissue in that ear now. Let's make sure none of that falls out. Good. Alright, let's check this other side. I'm just gonna use my tweezers here to remove the tissue. Good. Alright. Just take a quick look inside. See, that's softened up. Good. Good. Alrighty. Well, back to it then. Yeah. Yeah, ear cleaning is going to feel very, very good. Oh. I believe it's the stimulation of the vagus nerve. Not everybody gets that nice feeling sensation, but I admit I do, and I am definitely a deep ear scratcher with those Q-tips, and you definitely shouldn't be. Alright, how's that ear feeling so far? Good. Good, good. Just keep going here. Alright, looks like we dislodged most of the large pieces. I'm just going to go in gently with my tweezers here and pick out those chunky bits. Yeah. There we go. Okay, and let's see if we're left with anything in this one. Yeah, okay. Okay, pretty good. Alright. Just gonna do a few more drops just to soften up. There's like a little bit stuck on the sidewall there. So just a few more drops. And here we go. And not that much this time. It should definitely get the rest of it out soon. One more full tissue. Alright, let's go to this one. Let's pull out that tissue there. Good, good, good. Let's go with that pick and let's just get out the rest of that. pesky wax on this side. Good job. Good. Good job. Let's get that fluffy pick. Alrighty. Quick peek inside. There we go. Alright, let's take a look here. A little bit more stuck. Not a problem. Just go for round 2 on the drops on that ear too. And just a few on this one. There we go. Alright, and one more little bit of tissue in the ear there. I know I can feel a little weird. Back to this side. Okay. Let's see. Got enough of a lighted pick. Lets me see very well inside your ear. Just get a little bit more on the side wall. And then I think this one's going to be... Yep. Just got one little chunk to get out of there. And pluck. Good. Alright, let's take a quick peekarino in here. Beautiful. Nice and clean. Good. Good. Alright. Tweezers here. And back over to this side. Just gonna pluck that out. Alright. And let's take a little peek in here too. There we go. Call those the magic drops. They really loosen stuff up. Okay. That one's looking pretty good. One last little peek inside, and we're gonna just, oh yeah, nice and clean. Good. Alright, so we got the insides clean, and we're gonna do the outside too. So this is just a little skin blade. It is dull. It won't hurt. I'm just gonna scrape any dead skin cells off the outside of your ear here, okay? Yeah, it helps prevent, bacterial buildup. Plus, who wants dead skin hanging on their ears, And up here in the Neurological here, you kind of have a little bit of trapped debris. So maybe try to clean your ears a little better. Yeah. That's alright. Happens to the best of us. Okay. And on this side too, same thing. Slow. Scraping off all that dead skin on the outer ear here. Alrighty. Well, we are getting a little close to the end here. I just want to do a couple tests on you, just to make sure everything's all copacetic. So, it's my little acupressure tool. I'm just going to use it and press on different parts of your ear. You let me know if you have any kind of pain or sensitivity, okay? Alright, here we go. And good. 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 No pain at all? Wonderful. Okay, this side now. Any pain or discomfort? Okay, good. Alright. Great. So we're just going to give those ears a quick, I like to call this the polish. Just going to get everything could possibly be left on the outside of the ear here. Where's my other fun little brush here? Oh yes, the nice little feather brush. Always feels good. Really gets in those nooks and crannies. Good. And this side, this side. Alrighty. You have been a great patient. Alright, so we're going to wrap up tonight's exam with a few quick hearing tests. Alright, so I'm going to have you close those eyes for me. I'm going to whisper a word in your ear and you're going to repeat it back to me, okay? Alright, here we go. Sleep. Good. Vacation. Dream. Dratini. Pineapple. Haze. Lemon. Haze. Good. Granddaddy. Burp. Good. Flareon. Good. Jolteon. Good. Who's the worst Pokemon ever? Jigglypuff. Very good answer. Alright, my friend. Well, I think that's going to wrap us up for the day. Those ears of yours are completely cleaned. And if you ever need another ear cleaning, well, you just make an appointment at the front desk. Don't forget to like and subscribe so that you can always get alerted when we have openings. So, I hope you go home and have a great night's rest. And we'll see you again soon. Bye-bye. Alrighty, let's just grab that. 98.6, perfect temperature. So we're just going to move on with your full body exam today. This is a full head to toe exam. So I'm going to start with examining your face and head, asking you a few questions, alright? You let me know if you feel any pain or weird pressure during this. So, has your health changed in any kind of significant way over the last 6 to 12 months? Okay. Any surgeries, major, minor? Okay. Major injuries? Any new diagnosis, new medication, anything like that? Okay. And how's your drug or alcohol use? Minimal, I hope. No judgment. Good. Go ahead and raise your eyebrows for me like that. Good. Puff your cheeks. Good. Keep them puffed. Don't let me pop them. 1, 2, 3. Pop, pop, pop. Good. Pop them again. 1, 2, 3. Pop, pop, pop. Good. I'm just going to check your lymph nodes here. And how's your mental health been doing? Any feelings of depression, anxiety, suicidal thoughts, tendencies, anything like that? Okay, good. Want to be here for a good time and a long time. Just going to feel your throat a little bit. Just looking for any signs of thyroid issues. Good. Well, everything looks good there. So we'll move on. We're going to take a look at those eyes real quick. So we're going to start off real easy. And like you just look straight ahead. Look at my finger. And just follow my finger for me. Good. 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 Okay, so I'm going to grab my pen light here. And I'm going to have you just focus on my finger. Don't pay attention to the light. Good. Good. I'm going to check your pupil function now. I'm just going to cover one eye. I'm going to swing my light in and out, in, out, in, out, in, out, in, out. Good. Okay, and the other eye here, same thing. Out, in, out, out, in, out. Good. Okay. I'd like you to look straight ahead at me. Do not pay attention to this light. Don't look at the light. Just look straight at me. Good. Okay. Now I want you to follow the light with both eyes. Good. Yeah, it's a little bit warm in this office tonight. Good. Well, those are looking pretty good so far. I'm going to grab my ophthalmoscope here. I want to take a little peek inside your eyes. So all this is going to do is let me get a nice look inside your eyes. So I'm going to have you look straight ahead. I'm going to get real close, basically forehead to forehead, and you just follow my instructions. All right, straight ahead. Good. Look up, please. And down. To the left. To the right. Up and to the left. Up and to the right. Good. Down to the left. Down to the right. Alright. Let's take a look at the other side there. Straight ahead for me. Good. Up. Down, please. To the left. To the right. Down to the left, please. Down to the right. Up to the left. And up to the right. Good. Gotta say, I'm not seeing a single issue with those eyes. So we're going to move on. Everyone's favorite eye chart. What I'm going to do is I'm going to highlight a letter and you're going to read it for me. So what do we got right here? Good. Good. Very good. Let's get a little. Good. Correct. Correct. And now about all the way down here. Good. Good. And that one. Very good. Very good. Alrighty. Everything great so far. We're going to do one more little test here. Everybody's favorite Ishihara plates. So, simple color blindness test. Let's start off very, very easy. Would you tell me what letter or number that is? 8. Very good. 6. Good. Alright, how about this one? 5. Good. 3. Very good. Let's see if we trip you up here. 2. 6. Well, no fooling you. So I'm going to say that those eyes are in great shape. So I'm going to move down your body a little bit, and I'm going to take a listen to your heart and your lungs and your abdomen. Just make sure that everything is thumping, breathing, and gurgling as it should be. So if you'd like, you can just close those eyes. And I'm just going to listen to your heart real quick. So just relax, breathe normal. Good. Very good. All right, I'm going to listen to your lungs. So just breathe normal. Just breathe in and out normally. Okay. Take a deep breath in for me. Hold it. Let it out. Good. Deep breath in. Hold it. Let it out. Good. Listen to your abdomen real quick. Make sure those intestines sound good. So you just relax, breathe normal. Good. Okay. Everything sounds pretty good down the old tummy there. I'm just going to palpate on your abdomen a little bit, feel around your intestines, palpate your liver, make sure nothing feels swollen or anything like that, okay? So just relax for me. Just warm my hands up a little bit. Alright, here we go. I'm just going to palpate that liver. Just kind of, I know it's going to feel a little pressure on your side here. You know, like push my hands in a little bit, but everything feels good. Okay, I'm just going to feel that your lower abdomen here, just making sure I'm not feeling any kind of lumps, bulges, anything like that shouldn't be there. Alright, no issues. I'm just going to do a little percussion on your tummy here. Just make sure everything sounds good. So just relax. Good. Okay. And while we're at it, let's give you a little whack with the hammer, right? So we're just going to test your reflexes. Start with those elbows, and then we'll move our way down, okay? So just relax. Gonna hit that elbow. 1, 2, 3. Great. And the other side. 1, 2, 3. Good. I'm gonna do your wrist. When we do the wrist, gonna do about right there. Alright. 1, 2, 3. Good. And the other side. 1, 2, 3. Good. And everybody's favorite, the old knee. So you're already sitting on the table, legs hanging off. Just relax. Here we go. 1, 2, 3. Good. Other side. 1, 2, 3. Look at that little kick. Okay. So now we're going to move on. If I can find my otoscope to your ears, I'm going to take a look inside, make sure I don't see any signs of damage or anything like that. No excessive wax. And then we'll do a couple hearing tests. And then we'll move on to the neurological portion. My otoscope, just close your eyes. I'm just going to take a peek inside your ear here. Okay. Looks pretty good. And the other side. Both look pretty good. No signs of any kind of damage. No excessive wax. It's good. Alright, so I'm going to do a little test on your tympanic membrane here. So I'm going to use this little bulb to puff some air inside your ear against your tympanic membrane to stimulate it. It will not hurt, it might take a little, but no pain. So just close those eyes for me. Relax. And here we go. On the count of 3, I'm going to give you a little puff. 1, 2, 3. Good. One more time for me. 1, 2, 3. Great. And on the other side. And again, count of 3. One little puff. 1, 2, 3. Good. And 1, 2, 3. Great. Alright, so not seeing anything wrong with the ears. We're going to do a couple of hearing tests on you just to make sure everything is working proper. So I'm going to have you close those eyes again for me. I'm going to whisper a word in your ear. You're going to repeat it back, okay? All right. Here we go. Eevee. Good. Pikachu. Bulbasaur. Charmander. Very good. Squirtle. Wartortle. Charmeleon. Good. Ivysaur. Venusaur. Blastoise. Charizard. Very good. Keep those eyes closed. I'm going to make a noise like that in one of your ears. You let me know which ear it is. And here we go. Good. 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 No fooling you, is there? Good. And one more hearing test. Keep those eyes closed for me. You let me know when you can no longer hear the sound, okay? Alright, here we go. Or when you can no longer hear the airplane, apparently. Good. 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 Very good. Okay. You can go ahead and open your eyes, and we're going to move on to the final portion of the exam today, which is the neurological portion. So we're just going to run you through a few quick tests. Just make sure, all those nerves are firing, all the signals are getting to where they need to be, all right? So first things first, as I'm going to hold my finger up like this, I'm going to move it, and when I do, I'm going to have you touch your nose, touch my finger, touch my nose, touch my finger. Got it? All right, so you ready? So it's like, I'm going to hold it here, touch your nose, touch my finger. Good. Over here. Nose, finger, nose, finger, nose, finger, nose, finger, nose, finger. Good. All right, I want you to hold your hands up for me. Good. Go like that. Good. Can you go like this? Go like that. This, that. Good. Alright, so everything seems to be looking pretty good. So we're going to finish up today's exam with a few little neurological tests on your sensations. So we're going to start with the dull or the sharp test. So for sharp, you can see this is just a very blunt end of a wooden instrument, and this is a very dull blunt end. Okay, so I'm going to have you close those eyes. I'm going to touch you, and you let me know what object it is. Okay. All right, here we go. And good. Dull, very good. Sharp. Dull, good. Sharp. Sharp. Dull, good. Both, very good. Alright, so we're going to do something very similar, except we are going to do, let me find something that might throw you off a little bit. Let's see, what do we have that can be kind of fun? Alright, so what we're going to do is we're going to do one that is soft or dull. Alright, so here we go. Soft, good. Good. Soft, yep. Dull. Dull. Soft. Dull. Dull. Soft, good. For the next one, this is normally what I would do called a hot and cold test or warm and cool test, but we don't really have anything that's warm or cool. So we're going to substitute. So we're going to ask you to tell me if it's metal or if it's wood. Alright, so just close those eyes. And wood, good. Metal. Wood. Wood. Metal, very good. And we're going to do one more. And this is very, very, very simple. So I'm going to ask you if you can identify when I touch you with the object, whether it's a single point of contact or if it's 2 points of contact. Where the tweezers are at here. Okay? So here we go. Keep those eyes closed. And one, good. 2, 1, 2, 2, 2, 1, 2's my favorite. 1, 2. Good. Alright, so tell me about how long have you been experiencing this hearing loss in this ear? Okay. There's definitely a deep wax impaction here, so we'll get that out for you today. So that's definitely pretty clogged. But I'm just going to take a look in your other ear real quick. Make sure that there's no serious clog in there. So just relax for me. Good. Good. Alright, that one's not looking too bad. Your eardrum is, or your ear canal is pretty severely impacted on this side. I'm just going to do a very general inspection on the outside of your ears here. Let me know if you feel any pain, tenderness, anything like that. Discomfort. I am noticing a little bit of redness on the outside of your ear canal on this side. If you've been digging with Q-tips, let's try to stay away from that. Otherwise, I'm not seeing any signs of damage or anything like that, so I think we just have to get this one ear cleaned out. We'll get whatever is on the other side too, and get you on your way today, alright? So you can just relax. You can close your eyes. I'm just going to get in there with my little pick, and we're just going to start scooping out some of that wax, alright? Alright, so just relax for me. I'm just going to use this little pick, and just going to come right up close. And you just let me know if there's any pain or discomfort. See if I can just dislodge this chunk here. There we go. Grab my tweezers. And we're just going to see if we can just pick out. There we go. That's a big chunk. Don't worry about it. Some people are prone to producing more wax than others. Okay. Alright, I'm definitely seeing a better opening in that ear canal, but that wax is pretty hard. So we're just going to squirt a little bit of softening fluid in there. So you just relax. I'm just going to use this hooked syringe real quick. And here we go. Relax. And good. I'm just going to take a little piece of tissue and plug that here so that softening does not fall out. It's going to be a little funny, but it's going to be alright. And in the meantime, we're going to get that other ear for you, okay? Alright, I'm going to take a look at this other ear here. And we're just going to get out this wax on this side. This side's not that bad though. This is just your normal wax buildup. It happens to everybody. But if you push and twist and turn those Q-tips in your ear, you're more likely to cause an impaction. Okay, good. There's one little chunk in there. Just get that right out. There we go. Good. Just a little more scrapey. You doing okay? Just relax. How does that feel? Doing alright? Good. So that hair's looking pretty good. I'm just going to go in there with a couple of different brushes so that we can really make sure that's all cleared out. So, got this nice little fluffy brush. It's going to go inside. It's going to feel real nice. It's going to clear everything out. Just relax for me. Good. Just noticing a little bit of dead skin. I'm just going to scrape that off for you. Ear hygiene is very important. There we go. Alright, just make sure we get every little bit here. Good. Good. Okay. That ear should be feeling pretty good, and we will definitely double check that with the hearing test. Now I'm going to use these tweezers. I'm going to pop that tissue right out of your ear. There we go. Alright, so that should be nice and soft. So we're going to go back in. We're going to pick out the rest of that wax for you, alright? Just close those eyes for me and relax. Let's see. It's definitely a big chunk right here. Hold on. There we go. Don't be embarrassed. It's okay. Just gonna take a peek inside real quick. Take a look at that progress that we're doing. Okay. We're definitely getting there. Still a little bit more stuck to the inner wall. So we are gonna go back inside real quick. I'm just gonna get real deep in there. I feel a little pressure. There we go. That's gonna get dislodged right there, yep. There we go. That was definitely a stuck bit. Good. Just a little bit more. You're doing great. Just relax for me. There we go. Good job. You're doing very, very well for me. Good. Alright, so let's just double check that again. And there we go. Squeaky clean. Great. So let's just get that ear cleaned up and do the same thing as your other side. Scrape off any dead skin on the outside. And then we'll give your ear a nice little polish. Yeah, it is like a little bit of a spa treatment. Maybe I should open up the Dr. Tingle ear spa. Wouldn't that be funny? Alright. Just gonna get in there with some of these brushes and just really get that all cleaned out. Any little dust specks or anything, get those. Bye-bye. There we go. Plus, it does feel nice. People like the sensation of the small, fluffy brush inside their ear. And we're going to go through with the fun little brush here and just get that all nice and cleaned up. There we go. Great. How you feeling? Pretty good. Good. Alright, so I'm just going to do a little touch test on your ears. You let me know if it feels the same, feels different, any pain or pressure, okay? Alright, so I'm just going to pinch the top of your earlobes here. Tell me same or different. Good. And when I massage the earlobe, same or different. Good. And I'm going to do a little thing called thunder ears. So I'm going to cover your ears like this. Same or different. Good. Okay. So now we're going to run some hearing tests on you just to make sure everything's working, okay? Alright, so what I'm going to have you do is I'm going to have you close your eyes for me. I'm going to whisper a word in your ear and you just repeat it back to me, okay? Alright, so again, close those eyes. Here we go. Sleep. Tingle. Good. Rest. Snorlax. Good. Piplup. Good. Snivy. Dream. Good. Keep those eyes closed for me. I'm going to make a sound in your ear. You let me know which ear you hear it in, okay? Alright, here we go. Good. Good. Mm-hmm. Yes. Alright. So now we're going to do the same thing. You just tell me which ear you hear the in, okay? Alright, here we go. Good. Good. Both good. Good job. Good. So far, so good. I'm not really seeing any issues. But we're going to do one more test. You just close those eyes for me again. We're going to give you a little thunder ears. And what I want you to do is let me know which ear I'm no longer covering, okay? You ready? Alright, here we go. Good. Good. Both very good. 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 Okay. So everything's looking pretty good. I want to do one more test. I just need you to repeat back what I whisper in your ear just so I know that you are hearing everything clearly, comprehending things appropriately. Alright. Okay. So just repeat back to me what you hear me say. Alright. 3, 2, 1. Good. 10, 9, 8. Good. 7, 6, 5. Good. 4, 3, 2. Good. And 1. Very good. Well, you seem to be a very, very good listener. But I will say that I think your ears are A-okay. And you should be right as rain. So why don't you go home, relax the rest of the day, take a day for yourself and the night. No more jamming Q-tips in those ears. And if you'd like to make another appointment, please see our receptionist at the front desk. And did she tell you about our extended exam options? Okay, well, we do offer those as well, so you might want to check those out on your way out. All right, well, if you ever need us, you know where to find me. I'll see you again soon. Bye-bye.